Well, kia ora koutou. Thank you for the lovely introduction, and thank you all for being still awake in the post-lunch session to hear what Lois and I have got to say. When we asked Scott why he wanted Plunket to present at this symposium, he said, slightly tongue-in-cheek, I think, that if Plunket can embrace technology and adapt to a changing world, anyone can. He's right. We're a 110-year-old organisation, nearly as old as the New Zealand we know today. And if Plunket, the grandmother of New Zealand NGOs, can work a tablet, then frankly anybody can. In 2016, we launched an ambitious new 5-year strategy that sets out to achieve generational change in New Zealand. This was developed following 18 months of research, staff feedback and surveys of families and their experience with us Plunket. We worked closely with Professor Richie Poulton, director of the acclaimed Dunedin Multidisciplinary Health and Development Study. You might remember it from the TV1 series, Why Am I? It was pretty amazing, excellent viewing on a Tuesday night last winter. The Dunedin study found that what happens to a child in their first 1,000 days will influence their entire life. This critical period of time can be the difference between a life of happiness or hardship. It will influence the adult he or she will become and the path that that child will follow. And this led us to the vision you see in front of you, that in the first 1,000 days, we, Plunket, can make the difference of a lifetime. Once we'd landed on this vision, which of course was, entirely simple and straightforward, we then went on to discuss the process for how we were going to focus our people's energy on bringing that to life and the strategies we would use collectively to bring about the profound change that we're looking to make for children in their first 1,000 days. So we landed on 3 strategic goals that you can see there, and we sum them up and talk about them every day in terms of healthy tamariki, confident whānau and connected communities. And it sounds pretty simple when you say it like that, but achieving something like that is no simple task. And we've worked hard to develop 5 strategic themes that you can see there to inform our annual work plan and basically help us get there. It's probably no surprise to anybody here that these themes reflect those you'll see in the New Zealand Health Strategy. Put simply, we put tamariki and whānau at the centre of everything we do. We want our people to be supported to be high performers. Most of all, we want to be integrated and collaborative, and it's often that point that gets people most interested, because I think it's fair to say that Plunket has probably been somewhat of an island in the past, and I can assure you that is no longer the case. We are very interested in playing well with others and being a connector and being connected. We also want to be a learning organisation, and we want to be fuelled and informed by knowledge, data and insights. And to do all of that, like any NGO, we need a bright financial future. So, in short, we are modernising Plunket. As an organisation that is welcomed into the homes of 90% of all New Zealand newborns, Plunket is perfectly placed to make the difference of a lifetime in those first 1,000 days, and that's exactly what we're setting out to do. It's pretty clear we couldn't do this as the organisation we once were. We really did need to modernise, and the question we asked ourselves was, how do you modernise a 110-year-old organisation without losing its soul? And it's not easy, I can tell you that. In truth, as Scott mentioned, this journey began several years ago. And at that point, we did something quite unexpected. We went against type as an NGO, and we invested a substantial sum of money to modernise old and outdated infrastructure, to get our Plunket nurses and health workers off pen and paper and using a tablet and an application, our electronic Plunket health record. This was an incredibly bold move for a charity, and I know it was a decision not made lightly by our board at the time. It showed incredible foresight. They were very brave, But in the end, you've got to invest in yourself, even if you are a cash-strapped NGO. Now, don't get me wrong, because none of this has been easy, and it has taken an enormous amount of time. In fact, Lois and I have been talking about being a bit nervous about today, because we feel we might be a little bit underwhelming with our story. But I guess what it is it's very real. It's bloody hard work turning an organisation the size of Plunket around. And, it's an enormous program of change. But we've had good people with us, supporters like Microsoft, and staff, most importantly, that were ready to embrace new things. In a rapidly changing and evolving world, it became very clear that staying still is pretty much the same as moving backwards. But for us, it was important to note that you didn't always need the shiniest, newest technology to stay ahead of the curve. And we really had to begin by making better use of the existing technology in smarter and more joined up ways. At the heart of everything we've tried to do is the customer. And the key for us has been to go where the customer is and have the right tools when you get there. So it wasn't a matter of if you build it, they will come. More of a where are they and let's go meet them there, which I think does reflect the spirit of delivering healthcare services closer to home. And in that spirit, we've long embraced social media, for example, as a natural meeting place for our customers. I know this isn't earth-shattering, but Facebook, we have 36,500 followers, 91% of whom are women, 73% between the ages of 25 and 44, because, as you'd expect, our audience is mums, and mums come to us for support. And it's support like our 24/7 Plunket line. I've got some of my amazing Plunket line people here today. And it's hard to imagine a world before Plunket line existed. But in its day, the notion of providing advice from Plunket nurses over the phone was an enormous innovation. We took that one step further in 2014 when we started offering advice through social media, launching our Facebook chats, covering all manner of topics from breastfeeding to moving on from nappies, travelling with kids, and home safety. And using instant messaging, our Plunket line nurses were able to answer questions from parents in real time. I know it's not revolutionary, but for our families, it really was. And we haven't stopped there. With the recent introduction of Facebook's new live streaming function, we've truly gone live. Last month, we ran our first Facebook Live video chat. And we received over 900 views in the first half hour. This was a huge success for us. It's not quite Kim Kardashian breaking the internet, but we were breaking new ground. And for those of you that are remotely interested and you want to check it out, we've got another one happening tonight from 8 to 9 p.m. on tricky toddler behaviour. So there you go. Smart tech doesn't always need to be high tech, but that's not to say that we're not embracing the opportunities afforded to us by technology, and that we don't have plans to be smarter about our use of it in the future. So I'm going to hand over to Lois, who is going to tell you about just what we're doing in that space.
So before I talk about what we might do next, I'm just going to talk a little bit about the impact on delivery of services to families that the electronic Plunket health record has had. Because in short, the impact of the electronic record has been a better experience for our families. If you take the example, for example, of a mum who's having a particularly challenging time and needs to travel from where she lives to be with her family for support in the space of the early months, in the past, that would have been difficult for us to give her good continuity of care. And now we're able to provide an uninterrupted service because nurses in one part of the country can instantly access the record that's been created in another part. Kind of simple, even simpler. Sitting with a mum whose child, for example, has specific dietary needs and being able to point out to her the place on the Ministry of Health website where she needs to go for information. Not rocket science at all. Just having a handy device to access the internet, but not something we could take parents through so easily in the past. We saw the benefits of storing health records digitally recently during the Edgecombe floods. Plunket nurse Natalie was faced with the devastation of losing everything she'd built up in her Plunket clinic, and including all her resources over the last 4 years. But the thing that wasn't lost was the electronic health records. And generally across the country, it's helping our nurses provide better services for families, especially those who it's hard to reach, those who move frequently, or those who struggle to meet appointments. We can provide opportunistic care to those who a nurse happens to meet during her working day by accessing the electronic record on the spot. So we have started on our digital journey. Where to next? As Amanda said, obviously, we realise that this is just the beginning. Our aim is to have all families we're delivering services to on the electronic Plunket health record by mid-2018. Imagine the power this brings to our ability to mine our data for insights, helping us to understand what interactions and interventions make the most difference, especially for those who need it most. The EPHR was a massive modernisation for us. It threw us into the 21st century, but of course that's not where the story ends. To equip us to deliver our strategy, to future-proof ourselves, and to maintain our status as a vital Kiwi institution, we've embarked on a journey of significant organisational change. This has included changing the way we're structured and moving from area boards to a single charitable trust. It's included taking a critical look at how our roles and teams are structured to best support families, and investing in service design disciplines to start plotting out what the future could look like so that we can not only be ready for it, but shape it and continue to add value and add more value for young New Zealand families. And whilst Plunket is experiencing its fair share of change at the moment, at our core, we're still performing the role Sir Truby King saw all those years ago, helping the mothers or caregivers and saving the babies. Today's parents and grandchildren are operating in a very different context to our grandparents, but they still have issues based around the same core of concerns. For example, malnutrition has been replaced by childhood obesity as a topic of enormous concern. One of the ways we're starting to narrow in on people's changing needs is a smart use of data. Already, our EPHR dashboard provides daily feedback to management on the demographic and geographical factors affecting a large field workforce. We can quickly see parts of the country where we are struggling to deliver the contacts families are entitled to when they're entitled to them. And we can also analyse where things are going especially well and try to discover why. And more than that, we can have fresh, lively conversations with our delivery staff, our nurses and our health workers, based on information they can see, and we can interpret together. And that is a great aid to the culture change that we're undergoing. The different and a more informed conversation supports the high-performing people theme and the learning organisation themes that Amanda talked about that support our strategy. And that includes our goal that our staff feel supported in their efforts to deliver services to families and are as informed as possible about what works well and where the opportunities for improvement are. What do we expect the future to bring? The customer-centric approach that must be evident in this conversation is also central to our service design work. We're undertaking this work in order to inform our future Plunket services. We've taken an outside-in approach, first and foremost from the point of view of customers, of course, but also from the points of view of staff and other key stakeholders in the total system of care for young families. We're not going it alone. We've spent time doing research to understand the lived experience of our customers and staff, and we've gathered a wealth of insights already. We're doing this work using the knowledge and insights of a dedicated project team from across Plunket, made up of clinical and community and support office staff and managers, supported by a partner, ThinkPlace. We're learning from our customers what they need, what they want, and how access to information and support could be provided in a way that's appropriate to lives that are busy and complex in so many and varied ways. We've also learnt that prevention and early intervention services can sometimes get lost in the noise of survival or even just competing priorities. Six actually, discrete and powerful personas have emerged from these work, and we're using these profiles to inform our service design concepts and the new ways of working that will eventuate. This is still a work in progress, but we do have experience in changing, just as we have adapted from being a Karatani home for babies in Dunedin to a nationwide organisation of 1,500 people and even more volunteers. We will continue to evolve to meet the changing face of New Zealand. We found that technology is the answer to some questions and is a must-have, but it's just part of what it will take to change the experience of families who receive our service. Inspiring questions have arisen as our families, and therefore ourselves, have envisioned a transformed future where the services provided to families are multidisciplinary in nature. Wouldn't it change the game? Wouldn't it change the game if families in crisis or difficulty had services offered to them proactively and they could select, choose? If parenting feedback was provided flexibly when and where it was required, in real time over a variety of channels, and if those access channels themselves were multicultural and inclusive. If families could be empowered to take greater charge of the development journey of their children by interacting with their own health information, and especially, wouldn't it be transformational if service providers worked together and interoperated seamlessly behind the scenes? We understand we're only as successful as the system we work within. And we are inspired by the opportunity to collaborate with the sector going places, rather than being distracted by the challenges and consequences of working in what is, as we all know, a really diverse environment. You want to continue, Emma?
A bit of the long and the short of it with us, isn't it, Lois? This mic. Thanks, Lois, for giving a bit more detail about this journey that we're on. And I don't want anyone to think we're up here because we think we've cracked it. We've made mistakes along the way, without a doubt. But importantly, we've learnt from them, and we're happy to share them with anyone who wants to come knocking on our door, so that we can help you on your journeys and into technology, I guess. We're all working towards a healthier, stronger New Zealand, and I'm sure there are a lot of opportunities for us to work together. We like to think of the investment that we're making at Plunket as part of strengthening the healthcare system as a whole. That's really important to us, and a really good example is our current working relationship with the New Zealand College of Midwives. Some midwives here, I see, and we're working closely with the aim of trying to get our systems to talk to one another in new and better ways. But most importantly, thinking about putting the customer at the very centre of everything we do. We really want to work to make that transition from midwife to Plunket a seamless one and a happy one, and that's really important to us. Change is difficult, it's essential, and it is much easier when you do it together, I can tell you that. As one of New Zealand's oldest NGOs, we're really proud of our history, but we're also very future focused. We want to be around for the next 110 years, and everything we're doing at the moment as an organisation is geared towards making that happen, including, as Lois has mentioned, changing our organisational structure. So whilst today's discussions are about technology and the kind of healthcare and technology the kind of healthcare the technology of the future might enable, our key focus is on our customers, families, total experience, and what that might look and feel like in the future. And there's no doubt that emerging tech will have a part to play in helping us deliver the services that families want in ways and at times and via channels that work for them, not for us, but for them most importantly. And the key question for all of us here today is how can we collaborate and how can we work together as part of the health system to make that happen? Now, Scott asked us to throw out a challenge, or to consider throwing out a challenge at the end of our presentation, and I'm sure he meant a smart tech related one, but instead I'm going to throw out a different kind of challenge and an invitation really to work with us at Plunket using smart tech or just using smarts to help us make the difference of a lifetime for New Zealand children and families. So that's us. Thank you.